Let's talk about recovery from a facelift. Now, facelift is not a very invasive procedure because you're not going super deep. It's very superficial in most instances. So there's not a lot of vital structures that you can injure. But because the area is so wide that is undermined, there's really a lot of swelling, and it can be a lot to handle for a family member to take care of you. There can be drains in. We are looking to see if you have any issues with blood pressure or developing any fluid collections like a hematoma. So we require our patients to have a nurse for the first night. And if you live in the New York area, that's fine. But if you don't, we do require you to stay in New York for at least one night in a hotel. We're going to see you the next day anyway to check everything, to remove the bandages, to make sure that you don't have any fluid collections. And sometimes we place drains. Those drains sometimes we remove on day one, but if they're very active, we may leave it in for a couple more days and remove it on day 3. So just be prepared that there may be multiple visits in those first couple of days. The other thing to be aware of is that after the surgery, there may be some movement abnormalities in the face, where one side doesn't move as much as the other side. That's usually from the lidocaine, and that's pretty typical, and it usually will resolve within a day or 2. So don't be alarmed by that. Numbness of the ear and even of the face and neck is pretty common, and that can last weeks, if not months sometimes for the earlobe, but those things do eventually resolve. At about 7 to 10 days, we're going to be removing sutures. First suture appointment is in front of the ear. Second appointment, which is about 10 to 14 days, is the sutures behind and along the hairline. So we're going to see you 3 times minimum in that first 10 to 14 days for wound check day 1, suture removal on day 7, suture removal on day 10 to 14. After that, most patients look pretty good at that 14-day level. You might take 3 weeks to get restaurant ready, but you'll be able to walk around and do things after that second week. Most of the bruising is gone, and the swelling in the neck is typically resolved. It's the facial swelling that takes a little bit longer, and that's what might put you into a 3rd week. After that 3rd week, there's pretty much no activity restrictions. You can do whatever you want, and basically there's just slow but meaningful recovery over the course of the next 10 or 11 months. The face does slim down, the swelling does go away, but it does take a while for that to happen. The incisions fade. They should eventually become basically unnoticeable, and by a year you should be in really good shape.